little bit about Paid Family and Medical Leave Act. Is paid family leave critical to childbirth, to delivery? Let's sort of break it
Yeah,
down for the audience.
I think regardless of who's paying for it, whether it's the government or employers, the postpartum period is one of the most like low hanging fruit. If we really wanted to do something about maternal morbidity and mortality, going back to the statistics you gave us early on to start this segment off, right? If we already know that Black people are 3 to 4 times more likely to die from pregnancy and childbirth complications, we already know that results in about 896 to 900 women per year.
Hmm.
40% of those deaths are preventable, and 40% of them happen in the postpartum period, right? Serena Williams' issues happened after her C section. She was postpartum at that point.
Yeah.
So, if we really wanted to reduce the largest proportion of what we know is preventable maternal death, 40% of them happen in the postpartum period. We
Yeah.
already know that. So paid family leave would afford us the opportunities to be able to get people the care that they need because they wouldn't be back at work ignoring symptoms, or they wouldn't be like, back at work ignoring symptoms and also being ignored by healthcare providers. We could be simulating earlier, warning symptoms, especially when we think about the cardiovascular events that cause a good number of the problems in the postpartum period.
Yeah.
We would actually have access to making sure that people would have earlier detection of those issues.
Right.
If we had paid family, if people didn't have to worry about losing their job and losing their employer sponsored health insurance that's associated with say a job, if we
Yeah.
had paid family leave, and if it was matched by the government, then that wouldn't just exclusively be on the employers to manage.
Yeah.
And then we need paternal leave too, because it's not just a pregnant capable person. You still got to bond with that person. Your relationship with that person changes. Y'all got to have responsibilities. And if you have other kids in the house, right, it's a
Mhm.
lot. And we're not treating, birthing families, childbearing families with the respect they deserve. Right? That's the other thing here, right? If we say we care about birth and we care about the proper propagation of our species, if we say we care about healthy future families, if we say we want to have, dignified citizens, then we would invest in paid family leave and public education.